Students, we will commence with our second lecture of occupational health. We will finish pneumoconiosis and we will proceed with lead poisoning and other aspects, which other important aspects of occupational health. Now, students, the hallmark of the prevention of pneumoconiosis is your dust control. It is very important that you make controlled dust. Now, what are various ways by which you can control dust in the environment? You can control dust by using wet processes, by using by spraying the environment frequently with water so that the dust particle may settle down to the air and the respirable air is clean of those particles. Then you can use exhaust ventilation. You can ventilate, you can keep building design in such a way that ventilation is ensured, or you can use certain machinery, certain fans which can improve ventilation in the area where the process is being done, so that the particles are diluted in the atmosphere, they are exhausted out of the environment, and the atmosphere for the workers is safe and is well protected so that diseases may be. Or you can use enclosures where the processes which are leading to the production of particles in the air may be enclosed in certain environment, and then they can be disposed of to some far off places properly, where the human contact is minimal and there is lesser chances of people getting infected, or people getting adversely affected. Now the next important topic with us is lead poisoning. Now, lead poisoning is a very frequently encountered occupational health disease, which is due to the contact with lead. Now, how is lead injurious to the health of the employee? How the lead enters into the body? There are various modes of absorption. It can be inhaled, it can be ingested, or it can directly be absorbed through skin. Now, the clinical picture of lead poisoning is the toxic effects of inorganic exposure are abdominal colic, constipation, loss of appetite, blue line on the gums, and stippling of red cells, anemia, wrist drop, foot drop, etc. Now, at times in paper scenario comes that a patient presents with foot drop and on peripheral blood film, stippling of RBCs is seen, or blue line on the gums is clinically seen. Now, in that case, you should think of lead poisoning and you should proceed your answer with lead poisoning. It is very important. Occupational health questions are usually scenario based. You are given a scenario on the health of a worker, and then you have to decipher the disease involved and you have to give preventive measures. Now, the toxic effects of organic lead compounds are mostly on the central nervous system, like insomnia, headache, mental confusion, and delirium. Now, this diagram shows various effects of lead on the body. On brain, it causes memory loss, lack of concentration, headache, irritability, depression. On digestive system, it causes constipation, nausea, and poor appetite. On nervous system, it causes damage including numbness and pain in the extremities. Reproductive system, it causes decreased sex drive, sperm count, and sperm abnormalities. In women, it causes spontaneous miscarriage. In kidneys, there are abnormal function and damage, cardiovascular, high blood pressure, बॉडी के अंदर फटीग है, मसल जॉइंट, एक्सेट्रा एक्सेट्रा. और बच्चों के अंदर बिहेवियरल प्रॉब्लम्स, लो IQ, हेयरिंग लॉस, लर्निंग डिसेबिलिटीज़, बॉडी के अंदर डिक्रीज बोन एंड मसल ग्रोथ, नर्वस सिस्टम डैमेज, किडनी डैमेज एंड एनीमिया एक्सेट्रा. Now, how will you diagnose, how will you proceed with the case of lead poisoning? Diagnosis में सबसे पहले history is important, where the worker is working, clinical features and laboratory tests. Clinical features we have already discussed, and in laboratory tests we will go for corpoporphyrin levels in urine and aminolevulinic acid in urine. These all are intermediate products of lead metabolism, or lead levels in blood and urine. They all are, and stippling of RBCs in peripheral phlegm. These are all pathognomonic signs of lead poisoning. Now, how will you prevent? You should substitute working with lead with some other product. You should go for isolation. You could go for local exhaust ventilation. Personal protection in the form of personal protective equipment is important. Good housekeeping has a major role in it. How things are placed in a factory, how processes are being done is very important, because this is how you can minimize the exposure of your worker to the toxic compounds. Working atmosphere, periodic examination of the workers, personal hygiene, health education, these are very important aspects through which you can drastically reduce the incidence of lead poisoning in the factories which are involved with working with lead. Now, next thing with us is occupational cancers. Now, occupational cancers may we have skin cancers in gas workers, oil refineries, tar distillers, oven workers. Then we have lung cancers in gas industry, nickel, chromium work, mining of radioactive substances. We have bladder cancer with in dyes factory, dyeing industries, rubber, gas, electrical cable industry, etc. Leukemia in the industries which work with benzol or reagent rays, radioactive substances, ionizing radiations, where radioactive material is being dealt. Leukemia is common. Now, how can you prevent occupational cancers? The control measures are the elimination or control of industrial carcinogens, frequent medical examinations, inspection of factories, notification of diseases if it occurs, licensing of the establishment, personal hygiene measures, and education of workers and management and research. If you will educate your workers regarding which materials are toxic and which diseases it can lead to and what are the earliest signs and symptoms of the disease, you can help your workers, or you can increase their capacity to build their capacity so that they can prevent their own selves by minimizing the exposure to such harmful substances. Now, occupational dermatitis is causes are physical, chemical, biological, and plant products. They can cause occupational dermatitis. Now, prevention can be done by pre-selection. You can select only those who are healthy at the time of recruitment. They don't already have any existing allergic condition or eczema or urticaria, which can further be aggravated by working in the environment where contact dermatitis is common. You can protect them by making them wear proper clothes, gloves, shoes, etc. Personal hygiene is important. You should ensure provision of warm water and soap so that they can protect themselves against the exposure. They can wash their hands and feet and face etc., and expose body parts frequently so that the contact is minimized. And one can go for periodic inspection of both factories and the workers so that you can triage and identify the cases who can succumb to or develop contact dermatitis in their early phases. There are certain factories, certain workplaces which have radiation hazards. Now, how can we reduce radiation hazards? We can do it by shielding of workers. For example, you can go and see in your x-ray rooms where shielded cabin is present, where the x-ray technician goes when he takes a radiograph. He goes over there so that his exposure is minimized. Then you can frequently monitor the employers for the adverse effects of radiations. Protective clothing, adequate ventilation is important. Replacement and periodic examination. Avoidance of pregnant women to go near work because they can be potentially hazardous for the newborn child. Now, in addition to all this, Radiological Association have developed badges, and they have limited, that maximum exposure an employer should not be more than 5 REM, so that if the badge shows that that exposure has increased 5 REM, that person is removed from that post and he should be given some other post, and some other new worker should be brought in to work at that post, so that work is not affected and the health of the worker is also preserved. All right. Now, another important topic, the important topic is sickness absenteeism. Sickness absenteeism means that in factories you are most often what you call you most often see that people present their sick leaves, and they want their paid leaves by claiming that they are sick. There are various causes of sickness absenteeism. For example, economic causes. A person may have to work want to work somewhere else. For example, जब खेतों में कटाई का सीज़न आता है तो बहुत सारे लोग जो है ना बीमारी की दरख्वास्त दे के अपने खेतों में चले जाते हैं और वहाँ पे वो काम करके सारे साल की गंदम जमा करते हैं. ठीक है, दिस इज़ वेरी कॉमन प्रैक्टिस इन पंजाब इन दोज एग्रीकल्चरल एरियाज़ where people are working in industries, but at the time of harvesting they take medical leaves from their factories or industries and go and work in fields. Then there can be social causes, for example marriages, deaths in the families. In all Eids, rituals, festivals, in all these cases employers, they want earned leaves, so they go for sick leaves. And they can be medical purpose, which is very much in lieu of the sickness absenteeism, that if a person or a worker is not feeling well, he goes for medical leave. And then can be non occupational causes. For example, and all rest of the causes can be placed under these causes. For example, birth of the child, etc., for which he needs to be, or for example a person who is not willing to work, he is kind of कोई निकम्मा बंदा है तो वो कहता है जी चलें जी मैं सिकनेस से मेडिकल लीव लेके 4 दिन घर में बैठ के एंजॉय कर लेता हूँ. तो these all are can be placed under non occupational causes. Now then, sickness absenteeism, how to prevent sickness absenteeism. Good factory management and practices, adequate pre-placement examination, good human relationships. Means if a factory is managed good, you are provided facilities over there, like if you are provided gym, if you are provided table tennis, lawn tennis, etc., there is a play area over there for the workers where they can spend some leisure time in playing and exhausting them their energies over there. They can have good time over there with their colleagues. Then sickness absenteeism will be reduced if they are examined before placement for any diseases or illnesses, or their psychological evaluation is done. Most probably you will be going to recruit healthy and more willing workers, and sickness absenteeism will be reduced. Then good human relationships. If you ensure good relationships between employees and employers, between management and workers, between the worker themselves, between lower staff and upper staff, then we will have less sickness absenteeism. And then we should apply ergonomics. Now ergonomics is a very important concept. Ergos and nomos, there are two words. We'll discuss it later, but the point remains that ergonomics means fitting job to the worker. It means that you should place a man in the job which best suits to his abilities, both physical, mental, psychological abilities. You should design the workplace, you should design machines, you should design furniture, you should design machine buildings in such a way that can be good for that suits well to the work and the worker. So this knowledge, this scientific field is the field of ergonomics. Now, accidents again are very important aspects of occupational health. What are the causes of accidents in factories? They are bad human relationships. Physical factors means the machine and the itself is hazardous, that can cause more accidents. Physiological, a person himself, for example, his eyesight is weak, or his coordination ability is not that good, so he can succumb to the accidents in the working environment. Psychological, he is not feeling up to it, he is lethargic, he's fatigued, he's tense, he's preoccupied, he's not giving his full mental energy or psychological energy to the work, so that can lead to accidents in the environment. And then environmental factors, the space between machine and the person is not good, ergonomics has not been applied well, so that can all lead to accidents in working places. Now, how you should ensure that accidents are minimized? You should ensure by adequate pre-placement examination, adequate job training. Job training is very important. Continuing education, then you should educate them in intervals, so that they keep themselves updated about the risks associated with the kind of job they are doing, so that they can keep on what you call training their own selves to prevent from accidents in the working conditions. Ensure safe working conditions. The working conditions should be as safe as possible, so that there are minimum injuries to the worker, there are minimum accidents and losses to the health of the workers. Now, establishing safety department and organization under a competent safety engineer. Safety engineers should be recruited, and that department should be made working, and the whole sole work of the department should be to do surveillance and look for those environmental conditions, factory conditions, machinery conditions that can make an employee or worker vulnerable to have accidents. He should promptly take care of those conditions that can potentially be hazardous to the health of the worker, and they should either replace it or make certain provisions and make the work safe. Periodic surveys for finding out hazards. All right. Now, health problems due to industrialization. This is again very important. There are various health problems that can occur due to industrializations. For example, environmental sanitation problems are there. Industrialization has led to the creation of slums for the workers around industries which have poor sanitation problems. Communicable diseases are very rampant in slums because of overcrowding, because of bad sanitation, bad sewerage condition. Food sanitation is also an issue. Industrialization, in areas of industrialization, proper good nutritious food is scarce. It is not being provided as compared to those who are working in agricultural communities. Then mental health is an issue. Accidents and social problems can occur. Morbidity and mortality is higher in industrial due to industrialization as compared to the communities which are agricultural. Now, what are various measures with which you can promote health of the worker? You should ensure good, healthy nutrition is provided to them. Communicable diseases controlled. For example, diseases due to waterborne diseases, through diseases through the mosquitoes or flies. So all these conditions should be well managed. Frequent vaccination rounds should be ensured in residential areas of the industrial workers. Environmental sanitation is very important. For mental health, you should have excursion places like parks, like gyms, like swimming pools for the workers and their families. Measures for the women family, like family planning or maternal child health clinics. And then you should go for daycare centers. You should ensure health education and family planning, etc. Now, nutrition adequate immunization against communicable diseases. For environmental sanitation, water supply, installation of drinking water fountains, drinking water coolers. For food, sanitary preparation, kitchens should be available. Storage and handling of food, education of food handlers should be ensured. For toilet, one sanitary convenience for 25 employees for the first 100 employees, and thereafter one for 50. And general plant cleanliness should be ensured. Now, environmental sanitation, sufficient space. The recommended standard is of minimum of 200 cubic feet. Lighting is standards for illumination: high precision work 50 to 75 foot candles, and regular work 6 to 12 foot candles, and corridor and passages 0.5 foot candles. And foot candles are units of illumination. We will read while discussing environmental sanitation. We should ensure ventilation, temperature should be proper, ACs, air conditioning should be present, so that if factories are involving work that generates heat, air conditioning should be proper, so that heat may not traumatize the worker. Protection against hazards, housing, these all are important aspects. Mental health, to promote health and happiness of the workers, to detect signs of emotional stress and strain, and to secure relief of stress and strain where possible. Treatment of employees suffering from mental illness and rehabilitation of those who become ill. Mayas for women and child. Expectant mothers are given maternity leave for 12 weeks. Provision of free antenatal, natal and postnatal services should be ensured. Health education again is very important. So family planning is important. Prevention of occupational diseases include medical measures. Now this is a very important topic. Prevention of occupational diseases, it includes medical measures, legislative measures and engineering measures. We will discuss it in our forthcoming lecture.